Hey there, VCE HHD students. My name's Andy. I'm a VC Health and Human Development teacher. In this short video, we're going to look at improvements in Australia's health status since 1900. This is relevant to Unit 3 VC HHD for the 2025 plus HHD study design. If you don't already, you can engage with the Health Resources Hub by subscribing to our YouTube channel by clicking the button in the bottom corner of the video there. That means you'll get alerts to all of our new videos coming out across the year. You can also see we've got our website there, the hrh.net.au, where there's opportunities for students and teachers, and that's being updated regularly, so please go and check that out. We've also got our Instagram, TikTok, and Facebook page where you can follow us and get alerts to our new videos and other opportunities, and also our email if you'd like to get in touch. So what parts of the course does this relate to? So you can see there the Unit 3 key knowledge is looking at reasons for improvements in Australia's health status since 1900, focusing on. So today we're not going to dive into those reasons. We'll do that in some subsequent videos. We're just going to look at improvements in Australia's health status since 1900. The key skill you'll see is asking you to be able to analyze data that shows improvements in health over time. So we'll focus on that today. It also mentions there draw conclusions about reasons for improvements, but as I said, we'll do that in a couple of other videos. So first of all, let's have a look at how Australia's health status has changed since 1900. And remember, we're focusing on improvements in Australia's health status, but it's a good idea to get a sense of what some of the general changes over time have been. So in the early 1900s, infectious diseases were much more prevalent than today. And so keep in mind that infectious diseases are those kinds of conditions that can be spread from one individual to another. And typically they are caused by things like viruses and bacteria. So you can see some examples there like diarrheal disease, measles, and tuberculosis. So some of these conditions are caused by bacteria, such as diarrheal disease, and others by viruses, such as measles. And it's a good idea to go and add in your notes a few examples of these conditions and how they're caused and transmitted, because that can help you in your sort of understanding of how these might be spread and impacts on health and well-being and health status, but also how they might be able to be prevented. You can see there the second point is looking at across the 1900s, there was an increase in prevalence of lifestyle diseases associated with behaviors such as tobacco consumption and a poor diet. So those are things like lung cancer, cardiovascular disease, overweight, and obesity. So these aren't necessarily improvements in Australia's health status, but they are changes, and it's just some good context to think about because that can be relevant when it comes to looking at some graphs and data. And for some of these conditions, there was sort of an increase for a period of time and then a decrease. So once again, looking at some data, you can examine that and have a look at where that sort of improvement may have begun. Then you can see there's some other changes in health status since 1900 at the bottom there. So an increase in life expectancy for males and females in Australia. So that happened steadily across the 1900s. A decrease in the under 5 mortality rate. So that's looking at the number of children under 5, typically per 1,000 live births that were dying. A decrease in the prevalence of infectious diseases, which we sort of mentioned, an increase in HALE, so health-adjusted life expectancy, so number of years in good health or full health that individuals are living, a decrease in mortality for injury and poisoning, and a decrease in the prevalence of respiratory diseases. So they're all looking at improvements in health status since 1900. Okay, so you can see here that this is an example of some data. So you could be presented with some data at the start of a question in, say, a SAC at the end of your exam. Could just also be asked, okay, to list or provide an example of an improvement in Australia's health status, but it's probably likely you'll be presented with some data and asked to interpret that. So you can see whenever looking at a graph like this, you should also always spend some time looking at the title and the axes and any keys and units. So this one here is looking at deaths per 100,000 in the population from 1907 to 2003. So you can see that down the bottom by looking at the title and the information included at the bottom of the graph there. And so they've given you the death rates by broad cause. And so for this one here, okay, it's a little bit different. It's not like a bar graph, okay, where they're just providing you sort of with the different conditions and then sort of providing you with the, I guess, amount of deaths or the number of deaths. They have provided you with sometimes what is referred to as kind of like a stacked graph here. So when looking at, I guess, the particular number of deaths per condition, what you're really looking at is you're looking at sort of the thickness of the section. So you can see here, for example, for circulatory diseases in 1937, you can see here that approximately, okay, 750 per 100,000, okay, and then that goes up to approximately, say, 1,300 per 100,000. So the difference between 750 and 1300, okay, is approximately 550. And so that means that when you're looking at circulatory conditions and deaths per 100,000 population, you're looking at that approximate 550 per 100,000, okay, deaths in 1937. So that's how you sort of read these kinds of graphs. And so that means that as you're sort of moving along over time, what you're looking for in relation to improvements is, say, a decrease in the thickness or sort of less color as you move along. So you can see as you move, okay, over time from 1907 to 2003, there has been, after a bit of an increase in circulatory condition deaths, a decrease, and those are often referred to as sort of conditions associated with cardiovascular disease. You can also see here for respiratory conditions over time, there's a decrease in that sort of navy color, so a decrease in deaths for that as well. Okay, you can see here once again for infectious diseases. Okay, there's been a decrease in that thickness of that color as well, and pretty significantly, and so that means there's been a decrease in also deaths from infectious diseases from 1907 to 2003. So that's what you're looking at when you're looking at sort of analyzing and interpreting information from a graph like this. You can see here, this is now a table, so it's providing you with information in a slightly different way. So once again, making sure that you're sort of looking at the information in front of you. So the top 10 causes of death from 1907 to 2000. And so we're focusing here, okay, on males, and we're looking at 1907 and the condition, the percent of all deaths to 2000. And so you can see here in 1907, some of these conditions that were sort of towards the top here were some of these infectious diseases we mentioned earlier. So tuberculosis, diarrhea, okay, bronchitis. Now, if you look over here in the year 2000, if you're looking for some of those conditions, they're really not there anymore in those sort of top 10. So some of those infectious conditions have really dropped out, okay? But some of these other conditions here, so heart disease, cerebrovascular disease, which is like stroke, lung cancer, okay, prostate cancer, colorectal cancer, diabetes, okay, some of these lifestyle diseases that we were talking about earlier are much more significant in these sort of top 10 conditions than were, okay, over here in 1907. So once again, if you're looking at some of those sort of changes since 1907 to 2000, improvements in health status, you can use a table like this to look at some of those changes in those top conditions, which can help give you a sense of what might have changed, I guess, in terms of some of those health conditions. And as I said, in the subsequent video, we'll have a chat about, well, what might be some reasons for why some of this might have occurred. If you're a Unit 3 and 4 student, just a reminder, you can head to our website. We've got a free student newsletter. There's a link there at the hhd.net.au. You can sign up there for free using that link, and a couple of times a term we're sending out free SAC and exam resources and tips and advice, so head there and sign up if you haven't already. Okay, hopefully you found this video useful. Just a reminder, this resource, the ACE revision questions book that I've worked on for the new 2025 plus HHD study design, is available at book.acevce.com. It's got over 500 marks worth of practice questions, ideal for sort of SAC and exam preparation. They've all got sample A+ answers. There's also a full chapter on extended response questions and how to approach those with some sample extended response questions, and also a full Unit 3-4 trial exam. So if you head to book.acevce.com, you'll be able to access that. Okay, thank you so much.